For 3 years, my books were never full of hygiene and recalls. And so if I take 3 years, I pretty much only did new patients, hygiene sometimes included in that one, emergencies, and then treatment. At the Alfred Hospital was one experience. In private practice, it was a combination of a lot of composite, some endo, some extractions, some crown, some bridge, other kind of spaces as well. 3 years being fairly busy doing that versus 3 years where, let's say your books are 60, 70% full. Let's say half of your books are recall and hygiene. At the end of the 3 years, if I compare my experience versus that other person's experience, I might actually have a good 3 to 5 times the clinical experience than the same colleague with the same 3 years.
Yes.
And sometimes it seems crazy, like we're both 3 years out, and that's sometimes what we see is that there can be actually a huge difference between different practitioners at different stages, depending on obviously also their commitment to education and improving and obviously changing and not just doing the same things repeatedly. But that's kind of the maths. It can actually make a huge difference to invest in experience early on in your career, and that can really set you up for later on and done another 3 years of full-time study. I'm not saying that's definitely not for everyone, but I think you are right in the sense that most dentists, as they go through general practice, they'll find areas of practice that they do more of, they enjoy because they're better at it as they do more of, and that naturally creates areas of interest, and that creates more fulfillment, I think, for most people anyway.
But I would like to touch on the topic of exit strategies as well. Let's say you've worked at a clinic for some time and you realize that you and the clinic culture don't really fit, or you can't see yourself being there long term, and you want to look for another job. It's an awkward situation, and for a lot of new grads, they quite often end up just sort of keeping their head down and just keep doing what they're doing because afraid to have that conversation, like, not happy here, I want to leave. And quite often with our contracts, there's a period of notice that we need to serve so that the clinic can look for a replacement. And that period of time, I often hear from other dentists, it's quite stressful and awkward to deal with. So what are some of your suggestions on how to approach leaving a job so that you can leave the practice amicably and still have, if all the better if they're willing to provide a good reference letter, because that speaks volume.
This is something I think that a lot of people struggle with.